it was last July, and we were swimming in the pool, and all of a sudden Eric just said, "I'm seeing double. I'm seeing double." And so I pulled him out of the pool, and his eyes were visibly so crossed, and it really scared me. And of course, I think it was like July 3rd. A lot of places were kind of closed down. I immediately called our pediatricians. They were, shut down for the day. And so I called my personal eye doctor, and we got him in that same day, and he said, there's definitely some conversion going on here. You need to see a specialist. And so, we went home, and we called my husband's aunt and uncle, who are actually both optometrists, and they live up in the Baltimore area. And we said, "Hey, listen, we just kind of got this diagnosis. Like, what do you guys think?" And they said, "Let me put out some feelers, for the Montgomery County area." And that's how we actually got referred here to Dr. Applebaum. And, he got us in, within a week or two, did a very thorough exam, and gave us about, 5 or 6 different diagnoses for Eric. And, what was really encouraging for me is that I was worried, of course, that this was something neurological going on, because I could visibly see Eric's eyes crossing. And he reassured me that he's seen this before, and that, he can work with Eric, and that it wouldn't involve a surgery. Because as a mom, that was kind of one of my fears. I didn't want to put my child through an unnecessary surgery. And I had done my research on that, just to know that a lot of times it's not successful, and then you end up back in the same boat. So he gave us a plan for vision therapy for about a year. So we're about 9 months in.
It's been a long time at vision therapy, and it changed my life because, like, every Saturday I want to go outside and play, but I have to go to vision first.
Mm-hmm. And how does it help you?
It helps me not to see double, and I've got good at it, so I can make myself do it, and unmake myself do it.
So I've noticed a lot of changes. So before, Eric's eyes would just kind of, cross on their own, and he would kind of get stuck. And so through vision therapy, it's kind of trained him that when your eyes start to converge, we can show you how to unconverge them. And so now, if his eyes start to cross, he could quickly learn how to focus on something in the distance and uncross them. We also had a hard time with some reading. And this wasn't something that I necessarily noticed, because when we were reading at home, I would point to words and we would read, just by pointing to words. But when we don't point to words, what we found out is that Eric was actually skipping lines when he was reading. He just was skipping whole lines, which means he wasn't understanding what he was reading, so that comprehension wasn't there. And so vision therapy has helped us to read better. So, while we still, like, occasionally will point to some lines, he doesn't skip lines as often. And we also have a prescription for some glasses, which is awesome, because it allows Eric to, still do virtual school here in Montgomery County. And he can still play his video games that he likes to play, and he can do everything that he wants to do. And one of the really cool things that Dr. Applebaum was telling us is that this is really good for sports. So Eric plays baseball.
I just started playing my game today.
Yep, we had our first game today, and he did excellent hitting. And so, the vision therapy has really helped with, like, the hand-eye coordination, which has just been awesome. And so those are a lot of the exercises that we like to do at home that we talked to Dr. Applebaum about. We throw the Frisbee, we play baseball, we like to ride our bikes, and vision therapy has just helped with all of that.
I think I can throw better because I can see and aim with my eyes.
So I have noticed some changes in his attitude, and I think that his eyes were probably slowly starting to converge for a while, and I just wasn't able to notice it because it was so minimal. But then it got to the point where, it was really bad. And he would sometimes be frustrated. He did have some headaches, and I just wasn't maybe understanding some of the meltdowns, some of the falling apart, because he wasn't able to express, because he didn't really know what was going on. And so a lot of that has helped. We don't really get headaches anymore, which is amazing.
Well, sometimes in the car.
Sometimes we'll run the car, but that's different. But we don't really get headaches from like, being at the pool or doing some of the activities that we used to do. Because you know that when your eyes start to cross, you know how to uncross them, right?
It's easy.
It's easy. Yeah. I think that as opposed to doing surgery or doing something else, this is well worth it to put in the effort. We come twice a week, and it's something that if you stick with it, you'll start to see results. I remember with Eric, it took us, about maybe a month, and I could already notice a difference, which I didn't think would happen that quickly. And to keep practicing and doing things at home, just there's things in your everyday life that after you leave therapy here that you can do that will help your kids. And there is a way to make vision therapy fun. And so that's what I've seen. Eric has never been upset about coming here. He's always looked forward to coming here. He loves all of the doctors and the therapists. They let him play some virtual reality here, and that was a big hit.
That was the first day I came here.
Yeah, the first day they let him play virtual reality, and so they found a way to make it fun. And they said all of the doctors and therapists have just been so understanding, and they explain everything so nicely to us, so we understand what we have to work on. Yeah, so this was probably like the worst time to have a vision disorder hit, right? So we worked with Montgomery County, and it's gone okay. So Eric gets some extra screen breaks, which has really helped. But at the end of the day, being on a screen for that long just isn't the best thing. We did buy an extra big monitor for him, so he wasn't stuck using one of the little Chromebooks. And we're doing the best that we can. We take a lot of breaks, right? And we say it's important to get outside every day and run around just to give those eyes a break. But with virtual school, your eyes are more tired. They're having to work a little extra hard. And so I was very fortunate to be able to do vision therapy through this school, because I think that only helped him.
That's my whole story.